Alrighty. So, my name is Parker Williams, and
I'm Melissa Muldrew.
thank you for coming today to interview.
So welcome.
So, the first question today is, tell me a little bit about what you do.
So currently I am a certified medical assistant at a local urgent care. I'm clinical, so I work in the backside. So, you bring patients back, get the vitals, work them up, history, allergies, medicines,
Okay.
get to know all the things before the provider gets in the room.
Alright, and my second question is, what do you think your biggest challenge is in that position?
Ultimately, I feel like every provider is so different that you have to be able to adapt to different personalities and like workflow styles, and definitely, the needs of every provider is different. So that can be a little challenging at times.
Definitely tricky to deal with. And what is your favorite part about being in that position?
Well, I do get to see a lot of different things. I've seen like a eraser inside of a nose, lots of earwax,
Interesting.
lots of people of different ages and races, like in the community, and people who come from out of town. So it is a lot of variety. So that's positive.
That's very positive. What challenges do you face the most in the medical aspect of the field in a local?
Probably that, like me personally, my biggest challenge is that not everybody's brain works the same. Like coworker wise, not everybody's brain works the same. Depending on their experience in the medical field and like how knowledgeable they are of medicine, and like disease processes, that it can be a learning curve.
Yeah.
And it can be challenging to work with them.
Yeah.
Because it's always, the good thing is that, they're always learning, but it can be challenging because not everybody learns and picks up things as fast as the other.
Yeah, definitely. And has there been any previous roles in your life that you feel like have helped you in this position?
Absolutely. Every single job I've ever done has prepared me for the next one. But specifically this one, because this one is urgent care. So, I've worked for a cardiothoracic surgeon, and I've done a lot of orthopedics, which we do a lot of x-rays, so that comes in handy when you got broken bones. Some people don't know what to do, but like I do.
Yeah.
A lot of primary care experience, plays into this because, I'm really familiar with medicine. So yeah, it definitely has helped.
Yeah. So what does a typical day in your life look like?
Well, lot of variety, and like ultimately my job is to provide structure and like be a leader while there.
Yeah.
So whatever everybody needs is like my job to pull it all together and keep things flowing and going. You bring them back as soon as you can, work them up as thoroughly as possible, fix their needs, help their needs, whatever needs to be done, help the provider, document accordingly, make sure they're taken care of, and get them home safe.
Yeah.
Hopefully healthier,
Yeah. And do you feel like in this position you need a lot of leadership skills?
I think that you don't need them, but it is definitely helpful, yeah. Because actually, like where I am, there aren't a lot of leaders. And so that can be challenging because if they don't have initiative to do like if you use the last thing in a box, you know, they don't have the initiative or like the will, or they just don't think about it. You know, it's like all about how their brain works. You know, oh, I should probably open the next box, but when you do that, there's certain tasks that come along with it. So they don't mind not doing it and leaving it for somebody
not
like me.
fully completing the job.
Yeah.
I even see that at my job, like honestly as a server.
Yeah.
People would just get a box and get one thing out
Right.
instead of like fully putting it out.
Yeah. And just fill the box.
It for somebody else.
Yeah.
But
you know, it's like
definitely how those roles help prepare
pay it
you.
forward thing.
Yeah.
You know.
Definitely helps with your work ethic.
Yeah.
Having to deal with stuff like that.
Mhm.
But my last question is, what do you like the most about being in this position? I already asked you along those lines.
Yeah, but so this particular position, there is, and with this company, I'll say, there is opportunity for growth, and that is something that is often like, oh, you know, there's so much room for growth here, that you hear a lot, but normally it's actually not that true, and it can take a really long time to accomplish.
Yeah, so you're actually seeing that progress.
Absolutely.
Yeah.
And so, but because I do show initiative and I do have those leadership skills that all these other jobs and the knowledge all these other jobs have prepared me for, that, you know, it actually might happen.
Yeah, that's really like exciting too, and gives you something to actually like work for.
Right.
You know?
Absolutely. And it makes you want to do a better job.
Yeah, definitely.
Which I always want to do the best job possible, but, you know, it makes you like want to work a little harder.
Yeah, definitely. Well, thank you so much.
You're welcome.
I appreciate it.
Yeah.